This is Audible.
Tantor Audio, a division of Recorded Books, presents ADHD for Dummies by Jeff Strong and Carol McKendry, LCSW. Narrated by Anne Sprinkle. Publisher's Note. In this audio edition, you will hear references to figures present in the print and e-book formats of the book. Limit of liability, disclaimer of warranty. While the publisher and authors have used their best efforts in preparing this work, they make no representations or warranties with respect to the accuracy or completeness of the contents of this work, and specifically disclaim all warranties, including without limitation, any implied warranties of merchantability or fitness for a particular purpose. No warranty may be created or extended by sales representatives, written sales materials, or promotional statements for this work. The fact that an organization, website, or product is referred to in this work as a citation and/or potential source of further information does not mean that the publisher and authors endorse the information or services the organization, website, or product may provide, or recommendations it may make. This work is sold with the understanding that the publisher is not engaged in rendering professional services. The advice and strategies contained herein may not be suitable for your situation. You should consult with a specialist where appropriate. Further, readers should be aware that websites listed in this work may have changed or disappeared between when this work was written and when it is read. Neither the publisher nor authors shall be liable for any loss of profit or any other commercial damages, including but not limited to special, incidental, consequential, or other damages. Introduction. A lot of people have attention deficit hyperactivity disorder, or ADHD. Researchers estimate that in the United States, people with ADHD constitute anywhere from 3 to 6% of the population, or more, depending on which study you read. On the low side, this totals about 9 million people. Almost everyone knows at least one person with ADHD, whether they're aware of it or not. So rest assured that if you have ADHD, or are related to someone who does, you're not alone. Even though so many people have ADHD, the condition is widely misunderstood. Some people, including many healthcare professionals, believe that ADHD isn't real. These people believe ADHD is a made-up excuse for bad behavior and bad parenting. We want to assure you right from the start that ADHD is a real condition that affects millions of people. For many, it makes life very difficult. ADHD has a biological cause and can't be willed away through discipline or hard work. And the symptoms of ADHD can't be ignored in the hopes that the person will simply grow out of them. To reduce and sometimes eliminate the symptoms of ADHD, you need to understand this condition and receive knowledgeable intervention. The purpose of ADHD for Dummies, 2nd edition, is to help you gain a better understanding of ADHD and discover where to look for help. Our goal is to give you the tools to effectively address ADHD in your life, whether you, your child, your spouse, or your friend is the one with ADHD. About this book. ADHD for Dummies, 2nd edition, is unique among books on this condition, and that we've written it with the ADHD person in mind. We don't go into long explanations with obscure points. We go right to the heart of the matter and give you the information you need to know with as little fuss as possible. When we set out to write this book, obviously we wanted to offer basic information about what ADHD is and where it comes from. But We also wanted to provide information on cutting-edge treatment approaches and simple, effective strategies to help you start getting the symptoms under control and begin living the life you want to live. As a result, this book is short on background details and jargon and long on real-world advice. Both of us have many years' experience working with people with ADHD, and we draw heavily from these experiences in the sections that follow. In this book, we don't assume that you're the person with ADHD. Instead, we try to offer a view of this condition as if you, your spouse, your child, your grandchild, your friend, or your student has ADHD. Whew, that's a lot of perspectives in one book. Given the enormity of perspective that we try to cover, we can't very well list each of the possible relationships you may have with ADHD in each chapter. To keep things simple, we generally refer to you throughout the book, as if you're the person who has ADHD. However, in some instances, we do mention a specific perspective as it relates to a particular relationship, and in those cases, we write about your child, your spouse, and so on. Another convention we want to clarify up front is how we reference the condition we're writing about. In the mental health field, this condition is called Attention Deficit Hyperactivity Disorder, or ADHD. Most likely, you've also heard it called simply Attention Deficit Disorder, or ADD. We're talking about the same condition. We've simply chosen to use its formal name in this book. As you find out in Chapter 2, this condition has had many names over the years. Foolish assumptions. In this book, we only make one assumption about you. We assume that you want to read a book about ADHD that doesn't dilly-dally around with poetic descriptions and lengthy anecdotes, because you have very little time and want to get to the bottom line quickly. We don't waste your time with lengthy explanations, but we do want to make this book engaging to read, so we include some references to people we've worked with to give you insights into life with ADHD. Icons used in this book. As for all For Dummies books, we use a few icons to help you along your way. The Remember icon. Certain ideas and techniques are very important and worth remembering. This icon gives you those gentle nudges to keep you on track. The Technical Stuff icon. This icon identifies sections that are interesting but ultimately aren't critical to understanding the discussion at hand. You can skip them if you need to. The Tip icon. The tip highlights expert advice and ideas that can help you to better deal with ADHD in your life. The Warning icon. This icon alerts you to instances when you need to take special care not to hurt yourself or someone else. Beyond the book. In addition to the abundance of information and guidance related to ADHD that we provide in this book, you can get access to even more help and information online at dummies.com. That's dummies.com. Check out this book's online cheat sheet. Just go to dummies.com and search for ADHD for Dummies cheat sheet. Where to go from here? This book is set up so that you can read it from beginning to end, or you can jump around and read only those parts that interest you at the time. For instance, if you don't know anything about ADHD and want to get up to speed on the basics, start with Chapter 1. On the other hand, if your child is having trouble in school and you want to find some ways to deal with their challenges, you can head straight for Chapter 16. If you want to find out about the latest alternative treatment methods for ADHD, check out Chapter 11, 12, or 13 first. Regardless of where you start in this book, if you run across a term or idea that's covered in more detail somewhere else, we offer a cross-reference so you can locate the background information you need. Part 1. The ABCs of ADHD. In this part, understand what ADHD is. Check out theories about what causes ADHD. Survey the symptoms that most people with ADHD experience. Chapter 1. ADHD Basics. In this chapter, recognizing symptoms of attention deficit hyperactivity disorder, understanding the origins of ADHD, looking at ADHD diagnosis and treatment, coping with ADHD in your life. In 1980, a new term entered the common vocabulary, attention deficit disorder. It described a condition that has been recognized since the latter part of the 19th century, but called a variety of other names. This term, which later morphed into attention deficit hyperactivity disorder, ADHD, often rears itself whenever someone has difficulty in school or work, can't sit still, or is unable to control their behaviors. The symptoms of ADHD can affect anyone, people of all ages, genders, and socioeconomic backgrounds. Because of this fact, and because the symptoms of ADHD are simply extremes of everyday behavior, this condition is often misunderstood and misdiagnosed. In this chapter, we introduce you to ADHD. We give you a brief overview of the common symptoms, biological causes, diagnosis, treatment approaches, and life strategies for coping with ADHD. This chapter gets you up to speed on the basics, and we deal with each of these topics in much more detail in the rest of the book. Remember, as we point out in the introduction, ADHD is a complex condition that's estimated to affect between 3 and 6% of the people in the United States. Rest assured that many happy, successful people live with ADHD, including both of us. Having so many people around you with ADHD means that quality information, support, treatments, and life strategies are available that can help minimize the negative effects and maximize the positive. And yes, ADHD does have positive attributes. You can read about these in Chapter 14. Identifying symptoms of ADHD. If you have ADHD, you may have trouble regulating yourself. This difficulty can exist in the areas of attention, behavior, and motor movements. ADHD looks different in almost everyone. For example, one person may have no problem sitting still but gaze off into space, unable to focus at all. Another person may constantly fidget, but be able to spend seemingly endless amounts of time focusing on one thing, often to the exclusion of everything else in their life. Yet another person may not be able to stop themselves from impulsive and often dangerous behaviors, but may be able to sit calmly in school. The following sections break down both primary and secondary ADHD symptoms. Peering into primary symptoms. Despite all the different ways that ADHD manifests, the condition has 3 basic symptoms: inattention or distractibility. People with ADHD have problems focusing. You may be able to focus sometimes, but not others. This variable nature of being able to pay attention is one of the main features of ADHD. Because attention is inconsistent, people can easily rationalize or dismiss this symptom. Impulsivity. Many people with ADHD have trouble regulating their behavior. In this case, you often act without thinking, perhaps talking out of turn or taking unnecessary risks. Hyperactivity. Someone who is hyperactive is frequently moving in some way. You may be able to sit, but may need to move some part of your body when doing so. Leg rocking or shaking is one common example. This hyperactivity is more of a problem with children than adults because most ADHD adults have less physical restlessness as they get older and often find activities to channel it. The term Attention Deficit Hyperactivity Disorder, ADHD, comes from the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, DSM-5. The DSM-5 outlines 3 types of ADHD. Inattentive type. Having this type of ADHD means that you have difficulty focusing but are able to sit still. Hyperactive/impulsive type. If you have this type of ADHD, you struggle to sit still and have difficulty considering consequences before doing or saying something, but focusing isn't an issue. Combined type. If you have a hard time focusing, as well as difficulty sitting still or doing things without thinking, you have the combined type. The DSM-5 also rates the current severity of ADHD from mild to moderate to severe. These ratings are helpful to understand where you fit within the overall spectrum of the condition. Seeing a few secondary symptoms. Aside from the basic 3 symptoms of inattention, impulsivity, and hyperactivity, which we discuss in the preceding section, ADHD has a ton of other symptoms. These symptoms can include, but aren't limited to, the following: worry, boredom, loss of motivation, frustration, low self-esteem, sleep disturbances, hopelessness. In Chapter 3, we discuss these and other symptoms in detail. Technical stuff. These secondary symptoms are also connected to other common disorders. The overlap of symptoms among a variety of disorders is called comorbidity and is one of the reasons that diagnosing ADHD is so difficult. See the Getting a Diagnosis of ADHD section later in this chapter, or check out Chapter 5. Cluing in on ADHD's origins. Many people used to believe that ADHD, before it even had its name, was merely a behavioral disorder and had no biological basis. However, research since then has shown that people with ADHD have something different happening biologically than people without the disorder. What exactly that biological basis is, no one knows for sure. Some of the discoveries that researchers have made include the following. Genetic links. Having the disorder frequently is a genetic predisposition. ADHD runs in families. You're more likely to see a child with ADHD born into a family where at least one parent has it. Neurological activity. Some studies show that people with ADHD have brain function differences. For example, some studies have shown a lower level of activity in the front of the brain, the area that controls attention. Others have discovered activity abnormalities in other regions deep within the brain. Chemical differences. A certain chemical activity, such as dopamine and norepinephrine, seems to be different in people who have ADHD. Several studies suggest that there are differences in the responses when neurochemicals are created and released by people with ADHD compared to people who don't have the condition. This is an important component when it comes to choosing medication. Chapter 8 explores ADHD medications in more detail. Remember, Even after decades of research, the actual cause or causes of ADHD aren't known. But despite this lack of completely detailed understanding of the causes, they do know a lot about how to treat the disorder. We give you an introduction later in this chapter in the section Viewing Various Treatment Approaches, and we write about treatment options in detail in part 3 of this book. Getting a diagnosis of ADHD. Diagnosing ADHD can be frustrating for some people because there's no definitive way to check for it. You can't see it in a brain scan. You can't test for it with a blood sample. The only way to diagnose ADHD is to do a detailed evaluation of your or your loved one's past and present behaviors. This job involves finding a professional who understands the subtleties and variations of ADHD and can make a differential diagnosis, a list of conditions that have the same symptoms. The following sections give you an overview of this important process. Choosing your professional. The first step to finding out whether you have ADHD involves finding the right healthcare professional. You may start with your family doctor or pediatrician, but in order to get an accurate diagnosis, as accurate as possible anyway, you need to see a professional who understands all the different ways ADHD looks and can review your history properly. Your options can include, but aren't limited to, the following. Psychiatrist. A psychiatrist is a medical doctor who specializes in mental illness and behavioral disorders. A psychiatrist can prescribe medication and often is up to date on the neurological factors of ADHD. Neurologist. A neurologist is a medical doctor whose specialty is the brain. This person often views ADHD from a biological basis and can prescribe medication. They may not be up to date on the best ADHD life strategies or alternative treatments. Psychologist. A psychologist is trained in matters of the mind. Most psychologists understand the criteria for diagnosing ADHD and can offer many treatment options. Some can prescribe medication depending on their license. ADHD specialist. An ADHD specialist can be anyone from a teacher to a therapist who has experience and expertise in working with people with ADHD. Specialists likely have knowledge of many treatment and coping strategies, but they aren't able to prescribe medication. ADHD coach. An ADHD coach helps you improve your functioning in the world. Coaches can come from many backgrounds: education, business, psychology, and their focus tends to be on practical, day-to-day matters, such as skills training. Like an ADHD specialist, a coach has expertise in working with people with ADHD, but usually can't prescribe medication. Each professional will immediately recommend the approaches that they're most familiar with and that fit their treatment philosophy. So, choosing the best professional for you depends partly on your values regarding medication and partly on how open you are to unconventional ways of approaching treatment. Tip. In Chapter 4, we help you explore your values and how they fit with each type of ADHD professional. You also find out how to question a professional to see whether their philosophy fits with yours. Knowing this information prevents you from feeling pressured to attempt treatments you don't agree with and helps you find treatments that fit your style. Preparing for the evaluation process. After you've chosen a professional to work with, as we explain in the preceding section, you can dig into the actual process of evaluation. This process involves answering a lot of questions and looking at your past. Chapter 5 gives you a heads up on the types of questions you have to answer, as well as the official criteria for being diagnosed with ADHD. Remember, diagnosing ADHD isn't easy, and a diagnosis either way isn't the final word. ADHD is one of many similar conditions, and even the best professional can place you or your loved one in the wrong category. We recommend that you seek a second opinion, especially if you have any doubts about the diagnosis. Chapter 6 introduces you to many conditions and symptoms that can appear to be ADHD or that can accompany it. Viewing various treatment approaches. Treating ADHD has so many approaches that one of the main struggles most people have when they're diagnosed with the disorder is to weed through all the treatment options and choose the best ones to try. Treatment options break down into several broad categories, which include the following. The most conventional treatment methods for ADHD are medication and behavior modification. Both are useful and effective approaches, but many other types of treatment can work wonders with the right person. Medication, counseling and therapy, coaching, training, behavior management, nutrition and supplements, herbs and homeopathies, neuromodulation therapies, rebalancing therapies, social skills training. We discuss each option in detail in chapters 8 through 13. Each treatment approach has a place, and many of them work well together. Knowing how to choose and what to combine can be difficult. Our goal is to make this challenge more manageable, which is why we wrote Chapter 7, where we help you develop and implement a plan for treatment success. Recognizing ADHD's role in your life. One of the best ways to deal with the symptoms of ADHD is to have a toolbox of strategies you can reach into when you run into difficulties. The more tools you have in this box, the easier life becomes. As we explain in the following sections, we dedicate an entire section of this book, Part 4, to helping you fill your box with the best tools possible. Accentuating the positive. ADHD doesn't just create challenges. In some areas, people with ADHD have multiple strengths. When you understand these positive attributes, such as heightened creativity, high energy, hyperfocus, and a willingness to take risks, you can discover ways to maximize and amplify them to help you succeed in the world. For example, you can identify your style of working to keep you on task and motivated to get a job done. We created Chapter 14 to inspire and encourage you to find your strengths and make the most of them. Dealing with daily life. Whether you're at school, at home, or at work, you can develop ways to minimize the negative impacts of your ADHD symptoms by using some strategies that have worked well for other people, including us. In chapters 15 through 17, we offer you insights, tools, and ideas for making daily life as successful and stress-free as possible. For example, we suggest ways to help you develop healthy family relationships, motivate your child with ADHD to do their homework, know your legal rights at school and in the workplace, keep organized on the job, develop a solid career path, and much more. We hope the information in these chapters also spurs you on to create your own unique ways of dealing with ADHD in your life. Chapter 2. Exploring the causes of ADHD. In this chapter, reaching back for historical views of ADHD, seeing how researchers investigate the roots of ADHD, investigating the potential genetic, neurobiological, and chemical factors involved with ADHD. Looking ahead at the future focus of ADHD research. No one completely understands the causes of ADHD. However, significant advances in brain science mean researchers understand more about the chemistry, structures, and workings of this complex organ than ever before. In this chapter, we review several theories about the causes of ADHD, both those that have broken new ground and others that have severely missed the mark. We also explain some studies that indicate that ADHD has a biological basis and/or neurodevelopmental basis, and others that address the role of genes and gene behavior. We explore where the worldwide research on ADHD is heading and what it means for the future of diagnosis and treatment. Gaining perspective from past theories. The earliest reference to the symptoms of ADHD comes from the ancient Greek Hippocrates, who thought it was an elemental imbalance, too much fire over water. Sir Alexander Crichton, a Scottish physician, made the first medical reference to these symptoms in 1798. In 1902, British physician George Frederick Still lectured about patients he'd seen with symptoms of ADHD, and since then, numerous theories about the causes of ADHD have been considered. In the following list, we offer a brief overview of the more common past theories of ADHD for a historical perspective. Some of these theories have been based on behavioral problems, bad parenting, willful children, but many have viewed ADHD as having some biological basis. Bad parenting. Blaming parents for the behaviors a child with ADHD exhibits is, on the surface, logical. After all, plenty of kids act inappropriately when adults don't supervise them properly. The difference is that children with ADHD can't be disciplined into not having the symptoms. They can be taught ways to cope and strategies to lessen their symptoms, but these strategies don't remove the ADHD. Warning. The blame the parents theory is, without a doubt, the #1 misconception about ADHD. Unfortunately, a lot of people still believe it. Don't buy into this theory. It's just not true. Defiance or willfulness. Like the bad parenting theory, the theory of defiance is based in logic because when kids without ADHD act out, they can be taught not to behave that way. The problem is that people with ADHD can't concentrate better by trying harder, and they can't stop hyperactivity or restlessness by willing it away. This theory is still perpetuated among people who don't understand ADHD. Poor diet. After researchers realized that ADHD wasn't caused by bad parenting or willful defiance, they started looking at other causes. Diet was one theory that garnered a lot of attention. A poor diet can, in fact, cause some ADHD-type symptoms in people without the condition, and it can worsen the symptoms of ADHD, see Chapter 11, but it doesn't cause ADHD. Allergies and sensitivities. Much like a poor diet, allergies and sensitivities can create symptoms similar to ADHD, such as inattention and forgetfulness, and these sensitivities can worsen symptoms for some people with ADHD. People who have these symptoms, but not ADHD, see them disappear when they get their allergies or sensitivities under control. Red dye number 3, which has been banned in California, is a good example of this type of substance sensitivity. Brain damage. One of the early non-behavioral theories involved the idea that people with ADHD have some sort of brain damage. This view was partly a result of the 1918 influenza epidemic, when some children who had influenza encephalitis developed hyperactivity, inattentiveness, and impulsivity. Toxic exposure. Exposure to lead and the accumulation of lead in the brain were once considered the cause of ADHD. Studies have suggested that some people with lead exposure may display symptoms similar to ADHD. However, lead exposure isn't the cause of ADHD for most people who have it. And lead isn't the only offender. Exposure to other environmental toxins during pregnancy or after birth can also cause ADHD-like symptoms. Traumatic brain injury. Like the brain damage theory, some people have believed that ADHD stems from lack of oxygen during birth or a head injury early in childhood. Although brain injuries can induce the same symptoms as ADHD, depending, of course, on where the injury is, they aren't the cause of ADHD. Remember, several theories on the origins of ADHD actually led to the identification of disorders that are distinct from ADHD. This connection illustrates how the primary symptoms of ADHD can be found in more conditions than just ADHD. We discuss various disorders that share the same basic symptoms as ADHD in Chapter 6. What's in a name? ADHD has been called many things since it was first observed. Two early names were minimal brain damage and, later, because at the time no one actually saw any damage in the brain, minimal brain dysfunction. Since its inclusion in the American Psychiatric Association (APA) listing of mental disorders, ADHD has been officially called the following names: minimal brain dysfunction, hyperkinetic reaction of childhood, attention deficit disorder with or without hyperactivity, ADD, a name that's still widely used outside the professional community, attention deficit hyperactivity disorder, ADHD. Coming at ADHD research from all sides. Since the first edition of this book, scientists have a much greater understanding of genetics and epigenetics, how your environment and behavior cause changes that affect how your genes work without actually changing your DNA. This explosion of knowledge is due in large part to the mapping of the human genome, which led to new theories about and treatments of many diseases, particularly cancer. So, how do neuroscientists come up with a working hypothesis that can be turned into a theory? They start by trying to understand how the brain and the mind, your thoughts and memories, for example, interact to produce particular types of learning, emotions, and behaviors. Then they try to understand how the study group, in this case people with ADHD, functions differently from the general population, and they try to find evidence of some biological difference to explain the differences they've observed. Studies looking at causes of mental health conditions, including ADHD, are global and wide-scale. In practice, scientists from different disciplines are trying to understand ADHD from different angles. Geneticists are looking for unique characteristics of the genes that people with ADHD inherit. Epigeneticists are looking at how different genes are expressed and what environments influence that, because environmental factors seem to heavily determine whether a gene gets turned on and expressed or turned off. Neuroscientists and psychologists are trying to find differences in brain function between people with ADHD and people without it. Remember, no single factor, genetic or environmental, causes ADHD. Rather, Developing ADHD involves a complex and not yet fully understood interplay between them. Both the genetic/biological and the environmental determinant sides have their theorists. More research is necessary to understand the roles of risk factors before birth, of epigenetics, and even of intergenerational trauma. Examining self-regulation's role in ADHD. The ADHD research taking place today is rooted in the recognition that people with ADHD have one core problem: the inability to consistently regulate their attention and behaviors. The following sections explore the nature of this problem and the various brain functions that contribute to it. Recognizing self-regulation as a core issue. ADHD may be primarily a problem with self-regulation. Self-regulation refers to your ability to attain and maintain particular states of functioning in a consistent and predictable way. Although anyone can struggle with self-regulation, especially when they're tired or uninterested, people with ADHD are more likely to have problems controlling their attention, managing their impulses, modulating their moods, and managing their activity levels. You must be able to self-regulate to be able to plan, organize, and perform complex thoughts and behaviors like you want, when you want. Otherwise, you aren't confident that you can call on the skills you already have when you need them, and you have no guarantee of being able to learn something new. On the surface, self-regulation seems to depend on your desire to control your behavior. That's true, but much more than simple willpower is involved. All higher brain functions are partly hardwired from birth and partly learned. Learning is just modifying the wiring through experience. In other words, your ability to self-regulate is a characteristic of the brain you were born with, as it developed through the experiences that helped you learn how to use it. Neuroscientists use the saying, "What fires together, wires together." The areas you try to regulate, such as sustaining your attention on a specific task or sitting still when you're asked, are things you can learn to do more effectively as you grow older if you get the right kinds of experiences. The ability to use your experiences to learn is partly dependent on your ability to attain and maintain consistent brain states, which comes full circle back to self-regulation. Linking executive brain functions and self-regulation. Executive functions are the brain functions necessary for you to be able to regulate your behaviors. Executive functions primarily cover these areas. Response inhibition. Response inhibition includes impulse control, resistance to distraction, and delay of gratification. According to researcher Dr. Russell A. Barkley, response inhibition is the core problem in ADHD. The rest of the executive functions draw off it. Working memory. Working memory is divided into two categories. Nonverbal. Nonverbal working memory allows you to refer to past events to gauge your behavior. For example, if you don't remember that interrupting someone while they're talking results in a negative social interaction, you may interrupt them. Verbal. Verbal working memory allows you to internalize speech, which results in the ability to understand other people as well as to express yourself clearly. Motor control. This function not only allows you to keep from moving impulsively, but also helps you plan your movements. Regulation of your emotions. Without this function, you may find yourself getting frustrated easily or reacting extremely to a given situation. Motivation. This function helps you get started and persist toward a goal. Planning. This function works on many levels, but the most significant involves being able to get organized and to develop and implement a plan of action. Executive functions are controlled in several areas of the brain, including the following. See Figure 2-1, which can be found in the print and e-book versions of this book. Frontal lobe. Basal ganglia, including the caudate nucleus, which is located deep inside the brain and therefore not indicated in Figure 2-1. Cerebellum, the small area by the back and base of the brain. As we discuss in the later section, anatomical, current research is finding that at least one of these brain areas seems to work differently in people with ADHD from the way it does in people without ADHD. Exploring current ADHD research. Although the exact cause of ADHD is still unknown, you can find no shortage of research into the biology of ADHD. This research fits into 4 broad categories: genetic, anatomical, functional, and chemical. If you know someone with ADHD, the focus on biological causes shouldn't surprise you. When you watch someone struggle with ADHD symptoms, you know that this person wants to pay attention, sit still, or control their impulses. But, try as they may, they aren't able to, as we discuss in Chapter 3. Remember, because we want to focus most of this book on ways to treat and cope with the symptoms of ADHD, we have to limit the amount of research we cover. In the following sections, we include a sampling of studies to give you an idea of what researchers are looking at and what they're discovering. Genetic. ADHD runs in families, so much so that when diagnosing the condition, an ADHD professional's first step may be to look at the person's family to see whether anyone else has it. Along those lines, many studies have examined ADHD from a genetic perspective. These include studies that look at adoptive versus biological parents, the prevalence of ADHD in families, twins' tendency to share ADHD, and specific genes associated with ADHD. Here's a short sampling of some of these areas of investigation. In 2023, a large international study identified 27 places in the human genome with genetic variants that increase the risk of ADHD. This number of locations is more than twice as many as previous studies have found. Researchers at the National Institutes of Health have identified differences in gene activity in the brains of people with ADHD. The NIH study, led by scientists at the National Human Genome Research Institute, found that people diagnosed with ADHD had differences in genes tied to chemicals that brain cells use to communicate. In other words, this study's results show how genetic differences may contribute to ADHD symptoms. Technical stuff. This research is one of the only studies to use brain tissue post-mortem. Several studies by Dr. Joseph Biederman and his colleagues at Massachusetts General Hospital have shown that ADHD runs in families. In one study, Dr. Biederman and his colleagues found that first-degree relatives, parents or siblings, of someone with ADHD have a 5 times greater chance of also having ADHD than someone who has no close relatives with the condition. A 2016 article published in the Journal of Child Psychology and Psychiatry showed that identical twins were almost 60% more likely than fraternal twins to share an ADHD diagnosis, and that fraternal twins were still significantly more likely to share a diagnosis than non-twin siblings. Anatomical. Researchers have conducted a few studies into the size and shape of the brains in people with ADHD compared to those of people without it. A lot of conflicting data exists in this area, but a few basic ideas have been suggested. One study suggested that the size of the corpus callosum, a bundle of nerves that ties the hemispheres of the brain together, is different in some people with ADHD than in some people without it. Other researchers have suggested that this part of the brain operates differently in people with ADHD than in others. A 2017 imaging study found that overall brain volume and specific brain regions were slightly smaller in participants with ADHD than in those without ADHD. Although anatomical research continues, most of the ADHD research being done right now focuses on differences in brain activity between the ADHD and non-ADHD populations. Functional. The brains of people with ADHD seem to function differently from the brains of people without it. This area of study is important not only because it helps explain the cause of ADHD, but also because these studies use relatively new technologies for imaging, specifically functional MRI, or fMRI. Here are some highlights from this field. Much attention is being paid to the task-positive network, TPN, and the default mode network, DMN. Functional MRIs show that when you do a task, the cluster of neurons in the task-positive network light up. When you daydream or use your imagination, you use your default mode network. fMRI shows that in people with ADHD, the TPN and the DMN are turned on simultaneously, whereas in a neurotypical brain, the DMN is turned off when the TPN is turned on. You can read more about this glitchy switch in ADHD 2.0 by Drs. Edward M. Hallowell and John J. Rady. This inconsistency is one theory on why some people with ADHD show such a difference in both distractibility and negativity compared with people who don't have ADHD. A study by Dr. Alan Zemetkin using PET scans on adults with ADHD discovered that when subjects concentrated, the level of activity in the front part of the brain, the frontal lobe, decreased from its level at rest. People without ADHD have an opposite response, an increase in activity in the frontal lobe when they concentrate. Chemical. For information to pass from one part of the brain to another requires the action of neurotransmitters, chemical messengers within the brain. A neurotransmitter allows one neuron or nerve to communicate with another. When the upstream neuron gets excited and wants to pass on information to the downstream neuron, it releases the neurotransmitter molecules into a closed connection, like an airlock in a submarine or a spaceship, called a synapse. The neurotransmitter then crosses the space to the downstream neuron's membrane and binds to specific receptors that cause an effect inside the receiving nerve. As we explain in Chapter 8, certain medications are generally effective for treating ADHD symptoms, and most of these medications affect one or both of two neurotransmitters, norepinephrine, also called noradrenaline, and dopamine. This effectiveness indicates that these two neurotransmitters are involved in causing the condition. These neurotransmitter systems are distributed throughout the brain in specific locations, and they have different effects based on the type of receptors that the downstream neurons have on their membranes. The receptors determine what effect a neurotransmitter has, and different types of receptors exist in different regions of the brain. A lot of research has been done in this area, showing a link between certain brain chemicals and the symptoms of ADHD. Some of the more elegant theories about ADHD consider the balance between norepinephrine and dopamine in the various areas they affect, including the idea that one neurotransmitter has more effect in one hemisphere of the brain than the other. See Figure 2-2, which can be found in the print and ebook versions of this book. Most of the neurons that have norepinephrine as their transmitter are contained in one area of the brainstem, the locus ceruleus. It's part of the reticular activating system, which is the area of the brain that controls the general level of activation of your nervous system, how aroused you are, whether you're awake or asleep. Dopamine is found in several areas of the brain, but the area that seems most important for ADHD is the part that projects to the prefrontal cortex and is probably responsible for significance, meaning, and motivation. One way to think about ADHD is that it's a problem of deficiency in the activities of norepinephrine and dopamine. When you have too little norepinephrine working, you aren't paying attention to your environment. When you have too little dopamine activity, then you lack motivation, determination of salience, sustained attention, and engagement. Getting down to the bottom line. The human brain is neuroplastic, which means the networks in the brain change through growth and reorganization. So, if you're trying to rewire your brain, have hope. You can teach an old dog new tricks, metaphorically speaking. The fields of genetics, neuroscience, epigenetics, and neuroimaging continue to expand at rapid rates. We imagine that knowledge of the causes of ADHD and the brain functions and chemicals involved will increase dramatically in the near future. As this all becomes clearer, you can expect that clinicians will have much better ways to help someone with ADHD cope with the condition. Chapter 3. The Many Facets of ADHD. In this chapter, examining the primary symptoms of ADHD, discovering secondary symptoms, exploring ADHD in a variety of demographics. Everyone has a unique nervous system. In fact, the infinite variability in how humans' brains work has given rise to the popular term neurodivergence. ADHD fits into this concept. ADHD can look different in everyone. One person may be able to sit still but not focus. Another may have very little trouble sitting still but constantly speaking without thinking, and yet another may not be able to sit still for any length of time while also having problems keeping focused on a task. Such is the nature of ADHD, and one of the reasons many people have a difficult time believing this condition exists. In this chapter, we list the primary symptoms of ADHD and discuss how these symptoms often give rise to others. We also examine how gender, age, race, and sexual orientation create special issues for people with ADHD. Picturing the primary symptoms of ADHD. ADHD has 3 primary symptoms: inattention or distractibility, impulsivity, and hyperactivity. These symptoms don't all have to be present for you to have ADHD, and if you do have one or more of them, they may not be present all the time. Chapter 5 explains how this inconsistency works. The following sections explore these symptoms and many of the ways in which they manifest in people with ADHD. inattention or distractibility. Remember, inattention means you have a hard time focusing on something. Distractibility means your attention is easily pulled from one thing to another. Inattention is at the core of ADHD, and it isn't as simple as never being able to focus. Nothing about this condition is as clear-cut as that. Inattention is, more accurately, a problem in being able to control or regulate how and when you focus on something. Regulation is a key word for people with ADHD. Check out Chapter 2 for more about regulation. We much prefer thinking about attention as variable or inconsistent. This point is where distractibility comes in. External and internal stimuli pull on people with ADHD much harder than on people without it. As a result, people with ADHD have a hard time staying focused on one thing. A key thing to know about this symptom is that it can look different in almost everyone, and it can change from day to day in each person. But even with such variability, a few basic characteristics of inattention and distractibility occur in people with ADHD. Not being able to concentrate. Try as you may, keeping focused on something is difficult, and at times, impossible. The worst part is that the harder you try, the harder concentrating is. Your mind may go blank, or you may have other thoughts that come into your mind. Being able to focus well on some things, but not on others. This symptom is one of the most confusing aspects of inattention in ADHD. Many people think that just because a person can concentrate on something means they must be able to concentrate on everything if they just try hard enough. That's not the case.